Great, thank you. First thing I want to do is just thank Dr. Amy and Dr. Jennifer for having me come out tonight. I think it's great that we're going to try to have this collaboration with the chiropractic and the therapy. Just like Dr. Amy was saying, if he goes and makes an adjustment, if you have an underlying tightness and a soft tissue near that, he's going to have to keep making that adjustment and keep making that adjustment. But if we can get those soft tissues stretched out, and you can be doing this 3, 4, or 5 times on your own at home, that's going to make those adjustments that much more beneficial and effective and get you better quicker, which is really the goal that we're trying to accomplish here. So I just want to say a couple things about this program that everybody should have a copy of. The first thing is try to make this program that it would be beneficial but also achievable by a wide variety of patients. So whether or not you're 80, 50, or 30, you should be able to find benefit and still be able to perform all of these exercises, maybe with a couple slight modifications here and there. The other thing I wanted to do is make this a program that you could easily do at home. So there's very, very little equipment needed. In fact, you can do every one of these stretches with just simply a chair or the ground. Now I've got a mat here and I've got a stretching strap, and I'll show you how to use those if you do want to have a little bit of equipment involved, but you don't have to have that, okay? The other thing, it'd be great if you guys could really try these stretches out while I'm here tonight to make sure you're getting the right feel, to make sure you're doing it correctly. You know, I probably won't be able to see everybody doing all of these stretches to correct all of the posture, but you'll be able to feel if you're getting the stretch in the right place. So before we get started, if everybody could just try to create as much space as possible. The first 5 or 6 of these are all going to be in the chair, so everybody should be able to do those. If we could just, try to get just a foot or so in between everybody there, and that way everybody can participate as much as possible. And as I'm going through these, please feel free to ask questions on the fly. I'd rather answer a question about the stretch that we're doing at that time than wait till the end and have to go back to it. So just ask questions on the fly. Are there any questions before we get started going through these?
As you go along, can you point out any contraindications for those of us with bad knees?
Yes, absolutely. That's a great question. So we'll talk about that and how you can modify some of these on your own there. And you know, a lot of these stretches, the majority of stretches are going to really impact the muscles and soft tissue in the low back and the lumbar spine. We do have a couple that are going to be for the front of your body, the anterior side, including the abdomen and the hip flexors, which are equally important as to keeping a healthy low back as the actual lumbar muscles are. And the other area that I'm really focusing on with these stretches are the hips and the pelvic and the glutes, right through here. To truly have a healthy low back, you have to have good flexibility throughout all of those areas. So we kind of incorporate all of these. So the first stretch is just sitting in your chair. The picture here has the gentleman crossing his arms. That's one way to do it that I'll demonstrate first. So you simply cross your arms and you're going to rotate to the right, trying to look over the right shoulder. It is important that you keep both butt cheeks on the chair as you do this. You don't want to be lifting up and overextending. Keep both butt cheeks on and just rotate. And you might hold this one for 10 to 15 seconds and then relax, and then we'll try the other side. Okay, and then relax. Now another way, if you feel like you want to get a little bit more of a stretch, is you would take, say we're going to stretch to the right, we're going to rotate to the right, we're going to take our right hand and reach behind our back. We're going to grab the outside of our right knee with our left hand and rotate like we're looking over that right shoulder. And then you can do that to the other side as well. So this time we'll take the left hand and reach behind your back. Grab the outside of your left knee with your right hand and rotate like you're reaching or looking over that left shoulder. Good. And again, you might hold that for 10 to 15 seconds. That's kind of the norm with me. The longer that you can hold a stretch, really, the more beneficial generally in terms of true tissue elongation. But I find a 10 to 15 to 20 second repetition is usually sufficient to get a little bit of a stretch there. Then usually I do about 4 reps of all my stretches, okay? That's not set in stone. If you want to hold a stretch for 30 seconds and you feel good doing that, that's fine. If you want to do 5 reps of one and 3 reps of the other, that's fine as well. But you know, 4 sets of 15 seconds is kind of just a baseline stretch measurement there. Okay. Any questions about the seated rotation? Okay. So the next one is a seated hamstring stretch. This one we're just going to extend. We'll extend our right leg first. You just extend the right leg, keeping that right knee straight. Okay. And you're going to put your hands on your right thigh, You're going to tuck your chin into your chest and reach your torso down to your thighs. You reach your hands down to your foot. Yeah, I don't make it very far on this one either. It's okay. Make sure you keep that knee straight as you go down, though. Yeah, you should really feel this in the back side of your leg. You may even feel it right behind the knee or down into your calf, or just in your hamstring. You know, Dr. Annie mentioned sciatica, and a lot of these stretches, like this, for instance, is truly a hamstring stretch. But if your hamstrings have good extensibility, but you can still have tight nerves in there, you can actually get a little bit of a pull on your nerve and help your neural glide as well. So if you have sciatic symptoms, you may actually feel this all the way down into your foot even. Okay, and then we'll try the left leg. So just straighten that left leg out, keep that left knee straight, hands on your thigh, reach down to your foot as you tuck your chin into your chest and drop your torso towards your thigh. And you know, I said 10 to 15 seconds. In reality, we're probably holding these for about 5 seconds right now. So that's what 5 seconds feels like. So when you go down into the stretch, don't go so far into it that you can only hold for 5 seconds. As soon as you start to feel a stretch, you're getting some benefit from that. So you don't have to kill yourself on every stretch. A nice, easy, comfortable stretch that you can hold for 15 seconds is kind of where you want to be with that. Okay? The next stretch, that's a seated piriformis stretch. And speaking of sciatica, this is a very important one. If you do have that pain that goes down the back of your leg, I usually always recommend this stretch. So this one, you're going to cross your legs. If you have knee problems, this may be a little challenging. Sometimes girth can get in the way as well, but if you can't cross your legs all the way, just getting it about halfway up your shin should be sufficient as well. But try to cross those legs if you can. And then you're going to lean forward, bringing your sternum, your breastbone, right to that knee that's up. You should feel this on the outside of your thigh and into your buttock. Where are you feeling it?
In my hips.
Okay, that's okay too. So when you try to do a stretch, every stretch has an area that it's targeting. But if you have another area that's tighter than that area, that may interfere with that. So if you have a really, really tight hip capsule, say you have really bad hip arthritis, you may feel this stretch in your hips more than your piriformis. And that's okay. It's still stretching an area that needs to be stretched. Usually that's okay. Okay, so let's go ahead and switch legs. Bring that left leg up. Good. And then we're just going to lean over that left leg, bringing your sternum to your knee. Again, if you can't make it all the way up, just drop that leg to the shin and still lean forward, trying to bring that sternum to the knee. All right.
Do I want to try to pull my knee up?
No. Once you have the knee crossed, that knee's pretty stationary, and you try to just drop yourself to that knee. So the next two on your sheet, they actually have the individual sitting on a yoga mat, which is entirely okay if you want to do that. That is a little bit more challenging. I'm going to demonstrate those sitting in a chair, especially since we're all sitting in chairs right now. I'll demonstrate it that way. But if you are looking for more of a challenge, go ahead and drop down to the yoga mat, and you can do those in that position as well. So this next one is called a seated QL, quadratus lumborum stretch, with a forward bend. The QL is a long, flat muscle that sits right here in your low back. So as we do this, we need to lean forward, but we also need to rotate to the opposite side. So as you lean forward, let's lean to the right first. You want to make sure you get your left hand on the outside of your right foot, at least about 6 inches out there, and try to reach down towards the ground. You may feel this in your hips, or you may just feel this along the left side of your low back. Relax, and let's go ahead and try that other side. So again, try to get about 6 inches to the outside of the left foot with your right hand as you reach down and turn to the left. And now we've got the mermaid stretch. This is kind of targeting the same area. This might get your obliques a little bit in the lats and the side for the lateral fascia as well. So you're just going to sit here, you're going to have your feet flat on the floor, you're going to have your hands on your lap. And we're going to stretch to the left first. That's going to be with your right hand, you're going to reach out to the side and reach over your head, leaning to the left. Again, you want to keep both butt cheeks on the chair while you do this, but you do want to shift your weight over to the left side. Now, to add a little bit more of a stretch, you want to turn your head to look up. So turn your head to the right to look up at that right hand. Good. And hold this for about 10 seconds. And then relax. And now we're going to take our left hand and reach across the right. And just to illustrate the point about, sitting in a chair versus sitting on the ground, when I do this sitting in a chair, I feel a really nice stretch on the outside of my low back. If I was to get down on the ground and do this, I would feel nothing but my hips. So depending on what area you want to target, you can change the position of the beginning position of the stretch a little bit. You might find that it's a stretch for a different area. So that's the first page. Does anybody have any questions about those 5 stretches on the first page? No, pretty simple. Okay. So the next stretch that we have on here, this is one that you would do on your hands and knees, okay? This is called child's pose. Now, it's very similar to the stretch we just did sitting in a chair where we were reaching forward and to the side. So if you're unable to get in your hands and knees, you would substitute that stretch, the one where you just did sitting and reaching to the side, with the child's pose, okay? But I'll go ahead and demonstrate this one. So to do the child's pose, you're going to start on your hands and knees. Now this would be if you have knee arthritis or knee replacement, getting on your knees can be very challenging. Sometimes this is where a yoga mat comes in handy because it adds just that little bit of foam barrier there. If you don't have a yoga mat, sometimes you can just put a pillow on the ground. If a pillow still doesn't do it for it, the best solution that I have that works for almost every patient that I have would be we've got these, they're like 1.5 feet by 1 foot blue foam Eric's pads, like 2 inches thick. And they're not cheap. I want to say they're like $50. But if this is something that's important to you, getting one of those blue foam Eric's pads may be, one of those.
Would you want this to bring you up a couple feet so everybody can see me
yeah, that's a
better?
good
If
idea.
you can do it on that.
See that.
Yeah.
Yes. Just get you up a little higher.
Ironing?
So this would also, if you had knee problems, getting something that kind of had this material on there might be good. Or you could probably even do it if you were stable enough on the bed, having that soft bed and kneeling on that might be doable as well. So again, you're going to start on your hands and knees, and you're just going to drop your bottom back to your heels. And as you drop your bottom back to your heels, I'm going to reach out with both of my hands. I'm going to reach out and drop back at the same time. I'm going to hold this for about 15 seconds. And then we've got the stretch that's directly underneath that, which is the child's pose with side bending. And this is going to be even more similar to the sitting in the chair leaning forward, because we're actually going to add a little bit of rotation. So with this, as I drop back, I'm going to reach to the left. And then I'll come up, and then I'll reach to the right. And I'll tell you, the stretch that we demonstrated where we were sitting in the chair, I didn't really get a great benefit from that, but this one I feel a really good stretch. So if you don't feel like you're getting benefit from that stretch, sitting in the chair and leaning forward, really want to try to do this, and that'll increase the stretch on the sides there.